Welcome to Three Thoughts On. Today we have the second episode in a series dedicated to autism. Last time we had Dr. Melissa King, and now we have Dr. Jessica Taverniti. Dr. Taverniti is a licensed clinical psychologist and board-certified behavior analyst. Her clinical practice, Kula Wellness, specializes in assessment and diagnosis of autism and therapy. She is also the founder of Nurolux, which is a clinical and educational technology company that restores hope for families impacted by autism. Dr. Taverniti has been working in the field of neurodiversity, TAY, Transitional Aged Youth Population, and young adults in a diversity of settings for many years. She is passionate about helping individuals and families work through life's challenges to maximize potential personally and professionally. Her experience ranges from infancy through adulthood, and has been conducting and supervising psychological assessments for over a decade for diagnosis of learning profiles, as well as Autism Spectrum Disorder and other neurodiversity disorders. Dr. Taverniti is a diagnostician of Canvas DX, which is the first ever FDA-approved diagnostic for Autism Spectrum Disorder. Prior to her current clinical work and her startup Nurolux, she was a clinical director and executive director for the Gersh Organization. Within this role, Dr. Taverniti supervised applied behavior analysis (ABA) programming within the Gersh Academies K-12 and ABA clinics, as well as oversaw training and ABA implementation across all Gersh organizations. In addition, she developed the Equine assisted learning and equine therapy program integrated into over 85 student schedules weekly. She has also supervised and developed doctoral training programs and worked as an administrator in higher education at the University of San Diego. I met Jessica a few years back, and at the time we discussed the possibility of working together. It looks like that time may come soon, and of course, when it does, we will share the results of that work with all of you. And now, Dr. Jessica Taverniti. Welcome to Three Thoughts On. I am so delighted to have today Dr. Jessica Taverniti on what it will be the second episode of a series on autism. Jessica, how are you today?
I'm very well. Thank you so much for having me, Raphael.
Well, I am excited to have this conversation with you. As you know, this is episode 2 in a series of dedicated to autism, and which is a topic that I have become very interested in as of late. Can you share with the audience your background and how did you get to do this job?
Oh, well, thank you so much for asking me, and I'm delighted to be here. So I've had the opportunity to be working with families in the field of neurodiversity with a specialty in autism for almost 20 years now. I had come to California to start graduate school in my path of getting my doctorate in clinical psychology, and I had the opportunity to work with a very severely impacted gentleman starting in kindergarten. And that really started my beautiful journey of coming alongside with families. I worked closely with he and his family, and his mom was actually somebody that was very outspoken as far as advocacy, not only for him and other children throughout the community and really nationally. And so that really opened my eyes to how important it was to be not only our best advocate for the children, but for other families as well. And so I had this opportunity to work with this family and many others in early intervention. And this was way back when many families were not necessarily understanding what autism was or how to ask for help or support before we had insurance reimbursement. And I really took it upon myself to be a trailblazer. And so I tried to meet as many people as I could within the community nationally. And that has started my journey, which has now turned into my career path. And I feel honored to have worked in various facets of early intervention. I've been able to be in higher education. I've been able to work in schools specializing in neurodiversity, designing programs such as equine therapy, alternatives. And now really I have a technology company to help families longitudinally for a lifetime. So through the different kind of challenges that I've had with helping families get access to care and really understand, that's now kind of been the culmination, and really the portfolio of my work. And now I'm doing that to make it scalable across countries, and impact as many families as I can as a clinical psychologist and board certified behavior analyst.
Wonderful. Thank you for sharing that. So let's get right into it. One of the things that Dr. King mentioned on the previous episode was the importance of getting diagnosis, for the children. Can you share your experience on that, and what kind of cutting edge solutions are there for both diagnosis and treatment?
Sure, this is really an important first step. And even before the diagnosis, I really want families to know it's okay to bring up to any professional that they might be working with. Typically, this is a pediatrician of any concern that they might have and questions. And I think I really want families to know that should be an open conversation with their pediatrician. This should be honest about any concern, question. Parents are the expert on their child, and I really want parents to hear and to know this. And so anything that they're seeing or doing that might just be different or they're wanting more information about, and getting more education, pediatrician is a great first place to have this conversation without stigma, without judgment, and really opening that door. As a clinician, right, we only know what our families are bringing into us, but we have some really incredible technology and companies that are out here to try and help families identify these concerns much earlier on in the process so we can get children the intervention as quickly as possible. And so, kind of starting on this diagnostic journey and unlocking these doors for families is important. And it really starts with our pediatrician, and so through that of tracking these kind of developmental milestones, right? So when early on, when are children starting to sit up? When are they starting to babble? When are they starting to walk? And Pathfinder Health has really been cutting edge on helping families track this milestone, and being able to monitor, what is quote unquote the majority of children at this age doing. I never like to say the term normal because what the heck is that? But we look for themes, right? I always say if we had a bunch of children in a room, the majority of them might be engaging or interacting this way. And so I really want families to think about that and to know that if your child is maybe doing something a little different, that's okay, but we want to get them the support that they need. So making sure that families are looking at these milestones and bringing them up to their pediatrician or other specialty care people that they might be working with. And then from there, if autism based on the screening, so they have different milestones that Dr. King had mentioned as far as the checklist when you go to the pediatrician offices for their well visits. And kind of within this, if there is concern that the child is maybe not meeting milestones as far as kind of eye contact, mobility, and language, if potentially a diagnosis or they're at risk for autism, the next steps would really be finding a provider that and or clinic that could give a full diagnostic profile. Now, I'm delighted to share that we and I have personally been able to team up with Cognoa, and they're the first ever FDA approved diagnostic for children with autism and from 18 to 72 months. And they are really unlocking the challenge and mitigating the waiting list. So this can be completed by a pediatrician or other, specialties areas like a developmental pediatrician, neurologist, psychiatrist, clinical psychologist. And really this was developed to giving access to care to families all around the country and not having to wait that 1 or 2 years to get the diagnosis. And so really I want families to hear the message is please connect with your pediatrician, your family care provider, clinical psychologist, and get that assessment as far as the milestones and really where your child's at as early as possible.
That is wonderful. I actually like a lot what you just said about normal. I think in many ways that is a problem word because it's not properly used, I think, in our society. I think Dr. Gabor Mate probably has the best definition of normal. He talks about how the word normal makes a lot of sense when you're talking about the chemical levels in the human body. If you have, if your hormones are within this range, then it's normal. If they're out of that range, then you're probably going to die, right?
Right.
And that's what normal is. But normal shouldn't really necessarily be used in terms with social behavior, because what's normal for a society doesn't necessarily mean it's good for the society, or that it's quote unquote normal in another community or another society. So I'm glad that you pointed that out, because I think that may be one of the things where people feel that resistance to try to go get the help early on. And it's because it is seen as not normal, where that word doesn't really play a role at all in what we're talking about. I mean, do you agree?
I absolutely agree from the standpoint of really, I find this of understanding where the child's at or where the family's at and helping them define what's important to them for their quote unquote normal, right? That looks different for everybody. What brings them joy? What what strengths do they have? What would they like to explore? What do they want to build on, right? Each family is their own individual unit, and in my view, I want them to help find whatever it is and how they're defining their normal.
So then we take the first step. We have some new cutting edge solutions for diagnostics. What comes next? Is it the therapy after that point?
Yes. So connecting to the different therapies that would be recommended based on your child's area that they've identified, that maybe we'd like to get them some additional support, right? So again, I don't want to say deficit area or this is an area of extreme challenge. It's really important that we understand. I oftentimes say, if we're looking at it on a continuum, we help those kiddos close the gap, right, as compared to those other same age peers potentially. So the therapeutic intervention that is recommended, um, empirically validated, much like Dr. King spoke about, is applied behavior analysis. And this is really important to get children connected as soon as possible. And nationally, we have a challenge because there's more and more families that are needing to connect with applied behavior analysis, but there's really a shortage of providers. So connecting as early as possible and getting on those wait lists, or simultaneously engaging with other therapeutic solutions that families can do in the meantime when they're waiting for the full kind of therapeutic intervention within their home or in a clinic for their child, they can certainly do. So there's many wonderful solutions out there through Summit Health. There's a parent collaboration and working with other parents and really kind of a mentor of how can they do some of these, therapies, and having a toolbox of interventions while they're waiting. There's Attend parent training, which actually gives parents the therapeutic kind of interventions while they're waiting for other professionals to come into their home. This is where I'm really excited about the opportunity of technology and how do we expand access to care through telehealth platforms, right? It could be even that families are getting support telehealth kind of recommendations for interventions for their child, and these therapeutic solutions. And so through VR, AR, AI, depending on where the families are at and really what they're needing, we can get these therapeutic solutions that really unlock the door of learning and kind of maximizing the outcomes, whether that be socially, as far as communication, or behaviorally, for the children. And so I really encourage families to be open to this process and starting with the empirically validated solutions like applied behavioral analysis, and then checking out other ones that might be available, of equine therapy, of music therapy. There's really incredible companies and solutions that have opened this up to the community of autism and their families, and I encourage parents to try out as many things within reason and doing their own research, and making sure it's a good fit for their child as well as their family.
So it sounds like we are at a place in time where the academic work that has been done for a number of years now in this field, and the empirical work that has been done, and then the research validated solutions world, like those three are now starting to overlap a bit more. And am I getting that right?
Yes, that is correct. And I think what's beautiful about that is there's no one specific solution that is the end all solution. And this is where, autism spectrum disorder is a wide variety of individuals, right? Of strengths within that continuum, as well as areas of challenge. And that's why I encourage families to do not too many things at once, right? Because we want to know what's working and what has the most impact, but to be open to having a few different modalities of treatment going on at the same time. So that might look like applied behavior analysis, as well as speech therapy, as well as equine therapy, as an example, to really see what's unlocking these, right? Kind of these neural pathways as we're building this skill and this repertoire. And then in turn, it becomes kind of like what we're seeing in academia and research, right? Of understanding why this is working and why we should be able to continue to tap into this, resource for a certain profile of individual. And that's really exciting. And I think that it used to be very siloed, where it was just, again, one specific treatment or one university was doing a specific research, um, kind of objective. And we were saying, well, this only works for a certain subset of individuals. And I really see the community coming together through academia research, as well as these applied technological solutions, and offering the best possible outcomes for our families.
Actually, that is exciting. I mean, there's always a gap, there's always a delay in the usability of technology that is developed through academia or through research, and when it's actually become useful for the population. And it seems, at least it sounds to me now, that that gap is being quickly bridged, because now, like you mentioned, there's now the first ever FDA approved for diagnostics, but there's also, on the therapeutic side, there's now a mixture of diverse solutions, both empirically validated and research validated and academically validated, that are available for people to try out and to see if any one or any combination of those creates or helps out with a particular child in a particular household, as opposed to relying too much on one particular thing that may have worked with one particular group of kids. So that sounds like enormous progress. That sounds like exciting progress.
Very much so. And I want to go back to something really important that you said, of families being open to explore different modalities. And I always say that it's important to ask, the questions and be educated on what it is, what is the objective, what is the outcome. But this is where we can really, we're encouraging families to be more and more open to research. And I want to tread lightly with that, because I think research oftentimes scares people. But really, I see this as an opportunity to be explorative with caution, and us really understanding of why something is helpful, how it works, and the mechanisms, of really kind of blazing the trail for other families ahead and their own family. And so, back to what you were saying, of what we have in research in various facets, whether it's through local autism clinics and they're doing research on different therapeutics, or we're doing research on genetic testing. There's a study going on nationally called the Spark study, which has been really instrumental in us understanding the genetic components of autism, across different family dynamics. So research really does inform kind of best practices into care, and we never know what might be best for that individual. And so I always say, be careful who you are engaging with, but through those projects, through universities, like you were saying, through different academia, even clinical trials, are really important for us to continue to advance our science, and how we can help support these families longitudinally.
I'm so glad that you said that, because I think this is one of the topics that I am very passionate about. I'm a proponent of science. I'm a proponent of living in a community where science is sought after, because it helps us understand, the world. And on average, people have some sort of fear of the research work, and rightfully so. I mean, the research work, independent of the area, is hard. It is hard to do a study and manage all the possible variables, which in a case of human behavior it's even harder than doing it, say, with a specimen, right? With a sample. When you're talking about behavior, the idea of creating a proper scientific study requires an enormous amount of time, obviously money, but more important than all that is how to segment the study so that adequate conclusions can be drawn. That means you have to look at all the possible variables that could be impacting the study, and that's very difficult. But it's part of the process, and we cannot not do it. We have to keep doing it, and to keep doing it, we need people to be open to trying it out, because that's how we make progress.
Absolutely. I like to liken it to if we were looking for advancement of treatment of anything medical, right? Um, we would want to try it out. We have to be able to understand how it works. And, the other component about research is, they're not able to set up, to your point, a research project and doing it without a plan or specific intentionality or, governing bodies looking over it to making sure it's going to mitigate the possibility of adverse effects. And I think I want to express that there's a lot of governance to this in a beautiful way of really making sure that we're setting it up in the best possible way. But we do want to, I just want to reassure families that, and I would encourage you to be curious about this and open to this, as through the different universities that are doing this or the different research projects specifically in autism, we're trying to answer many different questions at one time, right? Whether that be through therapeutics or the genetic understanding, different interventions, understanding kind of longitudinally what will the outcomes be for the individual. But we really need families to be able to help us answer those questions. And we're only as good as the people that engage with us to get those questions answered.
So let's bring it full circle now. So we talked about some cutting edge solutions to diagnose. We talked about some therapeutics. How do we go about optimizing the outcomes for the families and their day to day lives?
Well, these families are definitely on an odyssey, right? I like to call it the autism odyssey. And this journey is going to look very different, for every family, but there's oftentimes themes that I see families go through. I encourage them to, strive for. And really, that's kind of much like we had spoken about earlier, finding what are the goals for the family? What lifestyle are they wanting to embrace and to adhere to? And I really encourage families to find their optimal wellness. And what I mean by families doing so, of making sure that the parental unit is the best they can possibly be in addressing their wellness of mind, body, spirit, of taking care of themselves. And it really starts at the top of the caregiver unit, and from there it goes down into potentially the individuals as well as the siblings, and really finding the family why, right? We talk about our why and business or our personal journeys, and I like to also encourage families to find their own why. Who are they as a family? Who do they want to be, and how do they strive for finding their purpose and their passions? And I really see this in finding the family strengths of maybe activities that they enjoy together, joining with different organizations, so they're finding a community of working with other families or other parents or other siblings that really understand kind of what this autism journey can look like for different families. And again, kind of much like we talked about with research or different therapeutic interventions, of trying different things out. I think it's because families are taxed in every which kind of facet of caring for their child or individual or searching for resources or answers, right? It's a very, unfortunately, we're in the system of a very reactive versus being able to show the world what we have. And that's really what I continue to try and do is, preemptively share with families of, hey, try this out. This might be something that is helpful for your child or your family. And so embracing in that whole family wellness and really having them define that, whether that's kind of spending time together on the weekends or they enjoy traveling to certain destinations or they're, like to go on hikes in nature if that's something that fills their cup. But making sure that the family unit is addressing their wellness first and foremost, and then from there it really creates this lifestyle of optimization and best quality.
So that's really interesting. I want to zoom out and then zoom in and share something with you and see how get your thoughts on it. So a couple of episodes ago, I had Dr. Scott Scher, who's my doctor. He's metabolomics. He's an MD. He focuses on health optimization through optimization of the gut biome. And the work that he and his colleagues are doing is just phenomenal. And he opened my eyes to the amount of research that has been done across the world on the impact in humans of unhealthy gut biome and how an unhealthy gut biome leads to hormonal imbalances, leads to brain fog, leads to a long series of problems that could be perceived as personality problems, right? In fact, he shared with me a number of papers on the ADD, ADHD community and how some percentage, I'm not going to quote it because I don't have the numbers, but there was a percentage of that folks in that community who were able to get better by improving the quality of their diet and by healing their gut biome, right? So there seems to be an enormous amount of work being put in how to get our nutrition to a place where our gut biome is healthy and the bacteria in the biome is doing the things for us that it's supposed to do for us, because there's this connection with behavior. So is there a parallel there, now zooming into the world of autism, about the importance of nutrition for the quality of life or of the children who are living with autism?
Yes, thank you for asking that important question. Kind of as we were talking about the whole family wellness, certainly that's important for the family unit, but specifically for the individual with autism, we are finding there is this constant kind of understanding that we're coming to as far as the GI challenges of an individual that has a diagnosis of autism. And depending on, right, the severity of the autism, the individual is going to be able to express different things, right? So sometimes we have nonverbal children that aren't able to necessarily tell us verbally, right, that they're not feeling well or that they might have challenges with like digestion and other foods might be bothering them. And I see that this is a really important kind of question mark that we need to do more research and understanding on and address it from, to your question of kind of this nutritional piece. And that oftentimes can be a two-edged sword for families, because some individuals with autism are great eaters and they can eat a lot of different textures and that tastes really good to them. And other individuals with autism might have a subset or 3 or 4 foods that is all they will eat. And so this poses a really big family challenge, right? Of even families that nutrition is really important and a well-balanced diet. And so this is where, additional kind of research, understanding, families continuing to try and test out of what is processing well within the body, right? How do we help with that gut, biome, and understanding what's going on in the individual of things that maybe might be more invisible, right? with certain subset of individuals. So I am hopeful that families continue to look at this, right? No matter the severity of the individual with autism, and I'm excited about different technologies that we're seeing that's coming out with this, different um, kind of nutritional solutions of making sure that we're getting kind of the balance to the kiddos that maybe wouldn't have normally be eating it or trying it out based on texture or different sensory challenges. So this is an area of wellness that I encourage families to continue to strive for, to try out. I know it can be continuously getting, discouraging for them. But it is important that we get to that kind of, like you said, the basic understanding of the genomes within the kiddos through as many solutions as we can to help maximize how they're feeling, and therefore we typically see a decrease in behaviors and an increase in readiness and acquisition of skills.
Very, very interesting. I guess it would be safe to say that a parallel can be drawn with exercise. Is there some work being done on that and the role of exercise and physical activity and the well-being of these children?
Yes, and I encourage again to bring it back to the whole family, right? Being active as a family and encouraging the individuals with autism to be active right alongside you, right? There's so many incredible local organizations that are doing, whether it's adaptive soccer, or adaptive skiing, or trampoline days. To be able to stay active, biking. There's a lot of wonderful community organizations that are teaching biking to individuals with autism. And the activity component is oftentimes, I think, overlooked just from the standpoint of sometimes it's hard to teach that new skill to the individual. And so that was, as I looked at doing my programming, that is something that I ask every family: is being active important to you? How can we make sure that the individual with autism is being active? And just like any of us, right, we need to develop that muscle tone, that motor planning, that gross motor planning, and longitudinally to give this skill and this blessing of being active um, to the individual. And so there is wonderful solutions with weight training, right, to get the whole family involved. Like I said, biking, even walking, um, finding different kind of sensory solutions. So they're moving their body in different ways, which is also helping with the brain development and the ability to their bodies to be regulated so they can learn. And we see a decrease in behaviors. And so really finding that sweet spot of activity, and how do we engage them and how do we get them kind of moving each day. Oftentimes they're really active, right? And so how do we lean into that? How do we take them, to the park? Or again, this is where, making it a family fun activity, and getting that individual out there moving their body, and then they're able to oftentimes be much more regulated throughout the day. And we see great learning opportunities if they're regulated and have had movement. And I included this, like I said, in all of my programming always has an active component for the brain development and well-being.
You mentioned music therapy as one of the therapeutic solutions. As an amateur musician myself, I love that. I think music is a universal language for all of us. Which side of music does music therapy fall in? And what I mean by that is it music therapy as the children listening to music, or is it music therapy as the children learning how to play musical instruments or learning how to express themselves through music, or is it actually a mixture of the two?
I would say it's the mixture of the two. And this is a beautiful way of letting, our children or young adults or individuals outlet kind of their expression that they might not be able to tell us in any other way, right? Unlocking, I always say, part of our challenge and our beauty is what are we unlocking in the individual, and we never know when that might be prevalent or evident. And so music, through whether it's body rhythm and getting them active, and sharing and kind of their joy and their expression, but also listening to music can be very calming. And so that can be some of the most kind of calming states that we see with individuals with autism is when they're listening to different kinds of music, whether they're engaging with dance, playing the musical instruments. There's incredibly talented individuals with autism out there in a wide variety of kind of musical expression. And this is something that I encourage every family to test out to see if that's something that, one, is a way for an individual to express themselves that they might not have been able to do so otherwise, or it could potentially be something that's really calming.
You also mentioned equine therapy, and I'm curious. I have seen, and I've actually had the fortune of seeing children with autism working with horses. It is a beautiful thing. They're magnificent animals, all around, and to see that interaction, that with the children, and in that chemistry, for lack of a better word, it's a beautiful thing. So I'm curious about that, because obviously not everybody has access to a horse, or especially a horse that is being used to work with children. Are there other animals that like dogs, for example? I mean, dogs do all kinds of amazing things with humans. Is there like dog therapy that helps children experiencing, autism?
Yes. So the connection with animals is something that is just such a beautiful um, gift. I think that many individuals with autism connect very well with animals, and I always, if I have this opportunity to see an individual with autism engage with an animal, I always learn so much, right? And it's just this gentle understanding of communication in all these nonverbal ways of unconditional love and calmness. And it so specifically, you asked about kind of two components, right? Of how are we understanding more about the therapeutic benefit of with dogs. And there's kind of more and more we're seeing that the dogs can be helpful with individuals that oftentimes have pretty severe behaviors. And the dog can be a really helpful calming strategy for that individual. Much like we hear about kind of this emotional regulation, having that dog with them when times when maybe they're upset or frustrated or not being able to communicate, that dog can really kind of give them an indicator of comfort. And they, come whether it's sitting at their feet or the child can actually, lay on them and regulate and calm themselves down. So this is something that if families are open to, with a therapy animal, with a dog, with their child, it can be a really helpful strategy for the individual. And then equine therapy, it's that can be a really special therapeutic modality for individuals, whether it's equine assisted therapy. And what that means is actually engaging with the horse and learning these functional skills of whether it's having to sequence different activities of feeding it or grooming it. And there's a lot of even therapeutic research that we're seeing of what that does to the for the individual as far as calming them as well, right? Grooming can be a really calming activity for the individual, but sequencing can be a helpful, like pre-vocational work skill. So that's how equine assisted therapy can be really helpful. And then we have equine therapy, which is a slightly different therapeutic model. And it's really special in using horses because they're mirror animals. And so if the child is exhibiting or the young adult is exhibiting a lot of anxiety, they're going to see that directly reflected. But there's a special understanding, again, through individuals on the autism spectrum. And when they are able to present very calmly, the horses very calmly, and they're going to nudge them and they're going to be able to, be close to them and they're going to be able to communicate with them in a way that you don't even need words. And so by helping with that kind of mirror, individuals are able to help understand how they can best kind of regulate themselves and calm their own anxieties. And kind of a next component to that equine therapy, and there's different activities that we lead them through, but there's also equine therapy that actually has the child or young adult riding. And this can be supported through different caregivers, but through the movement of the horse. And again, this direct kind of, information channel where the child or individual is sending messages to the horse and it's sending back to them. They are learning different things about their body and even kind of this mind body connection that we wouldn't be able to give them in other ways. A next component to that is hippotherapy, which is actually using horses, and it helps. We are doing speech therapy, physical therapy, and OT, and we are seeing great things through research of an increased mobility through that. We're actually seeing increased socialization, opportunities to actually saying different words that they wouldn't normally have access to through this special connection with a horse and these different therapeutic modalities.
That all sounds fantastic. Thank you for sharing that. Well, we are almost out of time. So, how would you summarize our conversation, and what would you like to leave the audience with for the families that are listening?
Sure. Well, I want to reiterate that a diagnosis of autism is simply a way of understanding how we might be able to best support or interventions that are available for the child or individually. And there is hope, right? A diagnosis of autism can often be really, families take this as it's very confusing, it's very daunting. And I want you to know that there's wonderful research going on, therapeutic intervention, and there's those of us in this community that want to be able to support and come alongside every family. And so the whole, ethos and mission of my company is restoring hope for families impacted by autism. And there are wonderful solutions out there, and really we have an obligation to families of neurodiversity, within those of us within the field that are working, is making sure we're getting you connected to the right solutions for your family to be able to optimize outcomes. So I want families to know that they're not alone, that there's solutions, and getting you connected to what's important, individually to your child, to be able to longitudinally know that this odyssey, can be one of empowerment and really a beautiful thing for families.
Wonderfully said. Jessica, this has been wonderful. I'm learning as I go. I am very, very lucky to be able to have these conversations with experts like you and Melissa. Thank you so much for your time, and we'll be talking soon.
Thanks again, Raphael. My best to you.